Good afternoon and good morning to those joining us from the West Coast. My name is Homira Osman, and on behalf of Muscular Dystrophy Canada, I'm very happy to welcome you to our webinar from our new Let's Talk NMD, Let's Talk Neuromuscular Disorders series. Before I introduce today's topic, I would like to mention that we have muted all participants, but I welcome you to type any questions or comments throughout today's session in the chat box. We have allotted time at the end of today's webinar for questions. Please note a recording of today's webinar will be made available by the end of the week on our MDC YouTube channel. With that said, let's get started. Today's weekly webinar will provide you information on management of long-term mechanical ventilation. As an organization that represents over 160 different neuromuscular disorders, we recognize that respiratory muscles can be affected in different ways by different disorders. For some neuromuscular disorders, there's a progressive dysfunction of muscles, and for some, there's a pronounced involvement of the respiratory and heart muscles, with worsening respiratory mechanics and an inability to cough effectively. Some rely on mechanical ventilation at home, and there is research to support positive effects of home invasive mechanical ventilation, especially in terms of improved quality of life. Today, there will be discussion on an exciting COVID-19 initiative that provides intense care management virtually using an e-health platform for all children and adults using long-term ventilation in Ontario. Now, despite the many challenges brought about by the COVID-19 pandemic, it has also been a catalyst for the rapid adoption of telehealth and has transformed healthcare delivery at a breathtaking pace. So we're very grateful for our excellent lineup of speakers that can help to address your questions and concerns about virtual care management with long-term home mechanical ventilation for individuals and their families with neuromuscular disorders. In advance of their presentations, I would like to thank each of our speakers for their time and expertise. I will now hand it over to Dr. Reshma Amin. Dr. Amin is a pediatric respirologist, sleep physician, and director of the long-term ventilation program at SickKids. She is an associate professor at the University of Toronto and an associate scientist in child health and evaluative scientist at the SickKids Research Institute. Her clinical and research interests include the respiratory complications of children with neuromuscular disorders, as well as children using long-term mechanical ventilation at home. Welcome, Dr. Amin. I'll go ahead and stop sharing so you can share your slides.
Thank you, Homira, for the introduction, and thanks to all of you for the invitation to present today. I am delighted to be presenting a COVID-related initiative that we've undertaken from a provincial perspective for children and adults who are using long-term ventilation at home. And I would like to introduce my other two co-speakers this afternoon. So first is Francine Buchanan. She is the Patient and Family Engagement Coordinator at Kids Research Institute. She's also a PhD candidate at the University of Toronto, and she's also the mother of a child who has a tracheostomy and uses a ventilator at home. And he spent the first 500 some days of his life in either the NICU or the ICU at our institution. It's also my great pleasure to introduce Ms. Regina Pizzuti. She's the co-director of the long-term in-home ventilation engagement or LIVE program that we've been working hard to deliver on during the COVID pandemic. And she is the manager of the Ontario Ventilator Equipment Pool. So it's our absolute pleasure to be speaking to you this afternoon about the LIVE program. So neither of the three of us have any conflicts of interest to disclose. We do not have a financial relationship with Atonix, which is the company that developed the virtual care platform that we'll be speaking about. So as many of you know already, or yourselves may be users of ventilation at home already, ventilator-assisted individuals are frequent users of the healthcare system, and they have a high associated burden of care. And really, as a patient and a family member going through the healthcare system looking for care integration, there definitely are several care gaps. And even as clinicians caring for this population, we face many care gaps in providing care to these children and adults over time. And these transitions can be quite stressful. There are communication gaps, and as a result of this can equate with unnecessary, preventable, emergent healthcare utilization, patient distress, and intensification of the family caregiver role.
Hi everyone, Francine Buchanan here. Pleasure to be with you today. We know what the population looks like. We know the scientific work that's been done to understand that population, but sometimes things that are overlooked when designing technology solutions is how patients and carriers feel. So it's important to know, to think about how it feels when you're going home with a from families as they're transitioning home. And I think it's a good impression about that feeling of concern about having that machine that you are just coming here. So imagine home for machine or we spent months in the hospital and there was always someone there to ask if you had a question, then all of a sudden you're home all alone. So what was the solution? You go to the next slide. And so what's the solution? So
Francine, sorry, this is Mary. I just want to let you know, it might be just your voice quality seems to be breaking up. Sorry.
Okay. Is that any better if I talk like that?
Much better. Thank you so much,
All
Francine.
right. So for our team, virtual care did seem like a good solution. Virtual care is defined as a tool or technology for between patients and caregivers and clinicians, the aim of facilitating or maximizing the effectiveness and quality of patient care. Virtual are used with a lot of populations. And you know what I'm going to do? I'm going to go to the next slide. I'm going to play the video for you and then hopefully fix my audio so that you can hear me better. How does that sound?
Great. Thank you, Francine.
Hi, I'm Daniel. I like to go out and enjoy the world with my friends, but sometimes they can be really hard. Oh no, I forgot the post up. So my mom and doctor came up with an idea. What if we did doctor from home? A touch away. So now I can connect my doctor from home. He can ask me questions to see if I'm okay.
Christiana, do you wake up at night with breathing difficulties?
Not at all. What's going on? And when there's a problem with my vent, help is just a phone call or text away. Now I have more time to play safely at home. And less time going to the hospital. God!
Okay. So you've seen where we've come from, and I just wanted to share with you that this idea of offering a virtual digital solution really came from Cristiano and his mother, who had seen this A Touch Away app at an eHealth conference, And then we had a discussion about it. We got to speaking with Atonics, and we found that for the first time, there really was a virtual health solution that seemed to be sophisticated enough to support the needs of a complex population, such as children and adults of users of ventilation. And the nice thing about this is that it would support customization to really get this platform ready for our home ventilation population. We were very fortunate to be able to secure funding to evaluate this virtual care intervention for ventilator users transitioning to home ventilation for the first time using a rigorous RCT design. So our research question was, what is the effect of a virtual transition intervention delivered through a virtual care platform on a tablet compared to usual care for individuals that were newly transitioning to home mechanical ventilation? And we were interested in looking at this on the following outcomes. So we want to see, was there an impact on healthcare usage? Was there an impact on caregiver burden and the impact on the family? Was this cost effective from the perspective of healthcare providers, and also including family caregiver time? And also, did this make things more efficient? So our study design incorporated a provincial strategy, and we were planning with 7 sites that offered home ventilation across the province of Ontario that account for 80% of ventilation users that are newly prescribed. These patients were going to be randomized in a 1-to-1 ratio. We were going to stratify by being pediatric or being an adult patient and having ALS or not having ALS. And our sample size was 440. And these new ventilation start users were going to be randomized to receive the Touchaway platform, that was going to be our intervention, versus getting standard of care. And as I mentioned already, our outcomes included healthcare utilization, and we wanted in particular to look at ED visits because we know that new ventilator users visit the emergency department at least once in their first year. And we wanted to look at outcomes including other healthcare utilization markers, participant and caregiver outcomes, economic outcomes, healthcare provider time, which is something that's often not considered. And we also want to look at the whole process. However, enter COVID-19. We had developed this Touchaway eHealth intervention for the home ventilation population for our CIHR funded randomized control trial. And we were all set to launch this summer. However, we all know that with COVID-19, we also appreciated that it was more important now more than ever to keep these children and adults at home safe. And through that notion, because we were ready to deploy, because we had developed this intervention for the trial, we were fortunate enough to be able to partner with the ventilator equipment pool, and they were able to provide funding to support a COVID-19 limited provincial rollout of this project, with 6 months of funding starting June the 1st. And I'll hand it over to Regina to tell you about our home mechanical ventilation program in Ontario.
Thank you, Reshma. Thank you to MD Canada as well for hosting us today. The Ontario Ventilator Equipment Pool is proud to be the lead organization for this COVID-related program. The Ontario Ventilator Equipment Pool is a centralized program operating in the most populous province in Canada with a population of 14.6 million inhabitants. The Ventilator Equipment Pool currently provides equipment and services to more than 7,300 clients, 5,000 of whom are mechanically ventilated, both invasively and non-invasively. The Ventilator Equipment Pool is funded by our Ministry of Health, specifically the Assistive Devices Program, and we receive an annual budget of approximately $8 million. The budget provides for both equipment and services, which include the provision of ventilators and inexsufflators, also commonly known as cough assist devices, to eligible persons of all ages, as well as the provision of oximeters to eligible persons aged 18 years and younger. So the VEP is uniquely positioned to provide some services which include the provision of equipment, both new and recycled, to more than 1,500 new applicants per year. The equipment procurement and selection process follows a very rigorous tendering and evaluation process that is in compliance with the Ontario broader public sector procurement process. And our team of respiratory therapists and biomedical staff evaluate all products with an emphasis on safety and clinical application suitable for the infant to the adult population. The VEP team of biomedical technologists also test every piece of equipment at the ventilator equipment pool for electrical safety and also to ensure that the technical specification of all equipment are met. Our team of respiratory therapists also provide troubleshooting assistance around the clock, 7 days a week. And we receive more than 10,000 calls during regular business hours every year, as well as approximately 700 calls in the after hours. The VEP is a repository of expertise in home mechanical ventilation, and the knowledge and advice of the staff is in much demand. Recently, the addition of a clinical learning specialist, the development of educational material, including educational videos and a variety of home mechanical ventilated related topics, can now be accessed from the VEP website at ontvep.ca. Many of the documents developed by the VEP can be found and accessed in the resources section of the app that we're discussing today. The VEP services also include in-home visits by respiratory therapists with expertise in home mechanical ventilation. These dedicated staff cover Ontario's geographic area, comprising of more than 1 million square kilometers. And we're very proud to say that we have no out-of-limit areas that are covered by our staff. Last year, the respiratory therapists made more than 1,600 home visits. A more recent addition to the roster of services offered by the ventilator equipment pool include remote monitoring and data download services. This is an exciting element of the TouchAway app because staff can now upload ventilator data directly to the app such that it is available to the entire home ventilator clinical team at the participating hospitals, but also available to the patients. And with the implementation of the TTLIVE program, remote monitoring and access to data is imperative to help support the patients at home. Thank you, Reshma. So during the early days of COVID, the team of physician, respiratory therapists, researchers, and parent advisors who were involved in the preparatory work around the RCT convened to discuss how we can support and care for some of our most vulnerable and at-risk home ventilated patients during the COVID pandemic. The group discussed the provision of the TouchAway app to support intensive virtual case management with the goal to keep patients out of acute care. Patients will download the app on their own device, and a subset are given a tablet if they have no electronic device or if they have no access to the internet or no electronic compatible device with the app. And this next slide's just to highlight some of the steps that we take during the live program. So a number of processes were developed early on and put in place very quickly. For example, all of the materials within the app were made available in both official languages. So in a stepwise process, step one, the clinical teams identify patients in groups of 20 and provide a list to the ventilator equipment pool. The VEP then reaches out through a series of introductory letters that are mailed directly to the patients or to the parents of the patient. And this is followed by an email from the clinical team directly to the patient, introducing them to the program. VEP then reaches out by telephone and provides the patient with a very detailed consent form for the patient to review. And a fair bit of time is spent answering questions that arise from the consent process, as we want to ensure that the consent is very informed. Signed consent forms are then emailed to the clinical team lead, who uploads it into EPIC, which is the hospital's electronic medical record system. After that, in the next step, the app gets downloaded and then gets populated with patient-specific clinical information. And then the clinical check-in occurs within the first 24 to 72 hours. And then finally, we get to the clinical care, which becomes available through the app. And this includes the patient, family, and home mechanical ventilation team communication, which can be done by secure text, secure message, secure audio, or secure audio-visual by the audio-visual means. The final step also includes the establishment of a care plan. Ventilator data downloads and workflows are also activated at this point. Some of the workflows include things like a weekly symptom monitoring and a monthly health questionnaire that is on an automated process and fires off at a predetermined scheduled period. Thanks, Reshma.
Okay, so what are some of the rules of engagement? So when we do a first clinical check-in as a clinical team, we speak with the patients and families about how we're going to be using the app with them, and we go through some of these different housekeeping rules. So we highlight that the app is not for emergency use, although you're able to call directly through the app. It does not connect to 911, so we stress that you still need to use your cell phone or your landline to call 911. We also review with our patients and their families the dates and times that our teams are going to be available and able to respond through the app. And we also make a contingency plan, and although we're trying to streamline all patient contact through the app, we of course have a caveat that if there's a major technical failure and the app is not working, we make it clear that there's another way to contact the clinical team when in need. At the present time, the app is not linked to the EMR, so we stress to families that if there's anything that is important in terms of documentation related to health-related activities, all of this gets documented as a priority in the EMR, and often there's double documentation that's happening in the app itself. We make it clear that for major health updates, we want those to be in the EMR, and that's not the purpose of the messaging. The messaging is really to get a hold of us and to communicate short, brief areas of communication. And we don't want the app to be used to communicate drastic changes in a patient condition or potentially distressing news. That really should be done through the use of 911 or an urgent clinic visit or call. So what does the LIVE program offer? So the LIVE program is really a way for the healthcare team to work with their patients and families to support them and help manage care at home safely and comfortably. And there's multiple different facets that you've heard about, and we'll go through each of these in detail. So patients and healthcare providers have the opportunity to secure message, to use video call, or to use simple audio call to communicate at the touch of a button. We work together in a patient family-centered approach to develop a virtual care plan that both healthcare providers and patients and families can input and edit. We work to connect the circle of care. So we work right now with the home ventilator teams, the patients and families, and also the members of the ventilation equipment pool to bring everyone together. We can work to do Bluetooth-enabled ventilator downloads, which has been such an incredible feature during COVID with our lack of in-person clinical visits. And then we've developed custom workflows, which we'll talk about shortly, that are automated check-ins with the patient family to really make sure we're on top of any potential issues that may arise. So here I've taken a screenshot of one of our patients, and this is what, if you went into the app, this is what it would look like. And at the touch of the button, I can message my patient and his mother. I can video call them, or I can audio call them. I don't have to dig around for email addresses or telephone numbers. And similarly, for the patient and family, at the touch of the button, they're able to call me, message me, or video call me, or the other members of our interprofessional team. So it really is easy, seamless patient and care team communication that's bi-directional. We also work together to develop a virtual care plan. And so here, if you go into the app, you'll see there's one icon that relates to identifying information, another that highlights who the care team is, what the medical conditions are. We have a detailed report of all the different types of respiratory technology. We also have a complete list of every single one of their ventilator settings and all the alarms. Some patients will use alarms and ventilator settings for their bedside ventilator, one set for daytime, one set for nighttime. We are able to reliably and accurately capture all of that information. So it's really helpful from a patient safety perspective. We capture their assisted cough device settings, what their home care supports are. So which nursing agency works with this family? When are those home care nurses coming in? What about PSW support? Which agency do they get for that? Who is their LIN manager? All of that information is contained at the touch of a button in this care plan. More about me. How many times as a patient have you been asked about what kinds of funding resources you available to you? Here is a way at the click of a button to itemize all of that and keep a record of it for easy access by patients and families and healthcare providers. We have information on their medications, their vaccinations and allergies. For patients where it's applicable and who are wanting this, they can fill out their healthcare directives and keep a copy of this on the app itself. We have several icons here that relate to how healthcare is utilized by the patient and family, so they can keep track of when they did go to the emergency room, what happened in their hospital admissions, which is also very empowering for our patients and families. Many of our patients who have neuromuscular disease have to have a special action plan and precautions about how to avoid different kinds of anesthetic, precautions around oxygen management, an action plan or steps to follow in the event of a pneumonia. All of this can be uploaded as a PDF directly into the app and again provide quick and easy access. There's a notes section where patients can write notes to us and we can write notes back and we can document those. And there's a section here that we'll talk about shortly where we can upload and download the ventilator downloads. So information is entered collaboratively by the patient, family, and healthcare team, and also updated collaboratively. So clinical workflows. So this was an interesting concept, and we thought if our goal is really to keep patients out of the emergency department, out of acute care, we really need to do a good job of regularly checking in on them. And so we developed two workflows. One is incorporating a standard validated questionnaire that's sent out monthly. And this questionnaire was used in a European telemedicine study for adult patients who were using invasive and non-invasive ventilation. So we have that, and that's sent out every month. In addition, we developed a weekly check-in of symptoms, both that review signs and symptoms that may become problems and also ventilator usage. And what's interesting is the patients and families are sent these questionnaires in an automated way, and how they respond will color code them to be either green, meaning everything is okay, a yellow, meaning there's a couple of things that we need to be considering and following, or red, okay, there's something we need to immediately reach out to this family or patient. So one of the examples of one of the questions on the weekly monitoring questionnaire is, in the past week, have any of the ventilator alarms been ringing off? And the question is yes or no. And if they respond yes, then they're prompted to specify which alarm has been ringing off. So just to show you, when I go into the app, I have all of my patients will appear before me. And depending on how my patients have answered the questions, they'll appear to me to be either status yellow, red, or green. If they appear red, what I do is I click on the patient and I will get this alert that comes up. And it'll say that the clinical team has to respond in less than 48 hours. I can then go into the workflow they've completed. I can look at see how they've answered their questions, and I know that when I'm reaching out to them, I already have a sense of what the potential issues are. So it's a nice way to really keep in touch with your patients closely and hopefully identify potential issues early and intervene early. And again, the goal is to keep patients safe at home and avoid, issues developing and progressing and requiring ED visits. So as you've already heard from Regina, one of the exciting aspects of the LIVE program is the ability to provide ventilator data downloads remotely. So for those of you who are patients who use ventilators at home or clinicians who look after patients who are ventilated at home, one of the biggest challenges is getting the equipment to the clinic to enable a proper download, both in terms of lugging it here by the patients and from the clinician side, both in terms of having patients remember to bring all of their equipment. So now we have a setup such that we can use Bluetooth capabilities to download the data remotely. The ventilator equipment pool can upload the downloads from the data into this icon in the app. And then as a clinical team member, we're able to then go into the app, click on this icon, and voila, our download containing rich patient data appears. And as a ventilator physician, this ventilator data is really a rich and valuable way, and probably one of the most important things that we rely on next to patient and family feedback with regards to following patients clinically. And this has become so important with COVID-19 because patients are not going to their sleep lab, they're not coming for in-person clinic visits, but this provides a way for us still to provide that detailed specialist care without needing to bring patients to the hospital. Lastly, one of the things that we're pleased to also be able to offer through the app is a list of resources. So when we go into our patient charts, we have an icon here that says resources, and we're able to upload a whole host of PDF documents, videos that patients and families can refer to when they need a refresher. So we can refer to this when we're troubleshooting with a patient with the management of their trach. We can refer to this when a patient might need a refresher in terms of how to clean their BiPAP machine. So it really is at the touch of the button and a way to get access to specialist level care. So I'll hand it over now to Francine.
Me back again. Hopefully you can hear me better this time. So I want to talk about what makes this solution different from other virtual care solutions. You go to the next slide. For us, first, it was really the mindset that the team took from the very start of planning and development. It wasn't so much about transferring the clinic experience into a virtual one, but really thinking about the issues that affected patients, caregivers, and healthcare providers to see how a technology solution could improve those issues. So for patients and caregivers, the problem was really about the fear of going home or the complications in dealing with the technology, the vent technology. For healthcare providers, the issue is really about getting the information they needed to support the patient's needs. So to ensure that we had this mindset in mind, the makeup of the study team was really important. So the LIVE family, everyone that we brought together, was picked to ensure that we had the right voices at the table from the very start. So we brought together pediatric and adult patients and caregivers and clinicians. We looked at all the ventilation programs across the province. We ensured that we brought together all those stakeholders and members of those teams. So it wasn't just researchers, it was really the clinicians, the nurse practitioners, the RTs, everyone who's involved in giving care was brought to the table. Of course, we had patients and family members, and then we had the technology support as well. So those that could tell us what we could and couldn't do. What we were really looking for amongst the team was a team that was working together on what was common amongst all of us and working together to co-develop and learn together what was possible, what was a problem that we might troubleshoot from different aspects, And really what that involved was daily meetings during the development phases. We were really asking questions of each other and getting answers. And then as we're looking at rollout, we have a weekly meeting with about 60 team members, and we talk about, when we were developing, we were really talking about, you know, what are the needs? How can we do this? What is burdensome for patients? What is burdensome for clinicians? And if we look at the next slide, you can see that this is our team that we meet with on a regular basis. Even at 8 o'clock in the morning weekly, the attendance is high, really because everyone's excited about the program, but also because different ideas are really listened to and implemented into the solution that we're building. I will pass it back to Regina.
Thank you, Francine. Okay, so where are we now? So as you heard with some of the work that was taken in the early days of COVID, lots of daily interactions, but following the development of our legal agreements with the vendor and also then legal agreements with all of the collaborating hospitals, we began a process of enrolling patients, beginning with those patients from the Hospital for Sick Kids in Toronto. And currently we are also enrolling patients from other hospitals, including the Children's Hospital of Eastern Ontario, the Ottawa Hospital, and Sunnybrook Health Sciences Center. We're very excited to have 80 patients enrolled to date, and it is expected that the remaining hospitals will begin enrolling patients in the next couple of weeks. At this time, we have both pediatric and adult patients enrolled. Interesting to note that we have several nonverbal adult patients who have chosen to enroll in the program and communicate through the app. So during our weekly meetings, one of the tools that we use is this map. And the BEP prepares a map on a weekly basis detailing the general locations of the patients enrolled in the LIVE program. And we use the FSA, or the forward sortation area. And this is used instead of the postal code because the FSA uses only the first 3 characters of the postal code, such as to maintain the patient privacy. The red dots that you see on the map represent patients enrolled through the Hospital for Sick Children, and the blue dots represent those enrolled from the Ottawa Hospital. Now, the size of the dots represent small, medium, or large clusters of patients, so these are not necessarily individual patients. As new hospitals begin to enroll patients, they too will be assigned a specific color, and dots representing their facility will be added to the map. So this weekly update of a map makes it easy to visualize a number of things. You can see, for example, a cluster of patients in Northern Ontario, and you can see the distance that some patients have to travel for care in the more typical way, and the distance that they are from their clinical home mechanical ventilation teams. The map also provides a visual reference to the number of patients that we are supporting through this important technology, as we now have an N of 80. I apologize, the map is from last week when we had an enrollment of 75. So every week it helps us to keep track of how many patients are on and keeps the team very motivated to continue with the mission. Thank you.
So now that we've got patients enrolled, we were kind of excited to hear what they had to say. Remember initially when this program was being designed, it was to support newly transitioned home patients to gain their confidence. Since we rolled it out to patients that were already initiated, it was interesting to hear what their feedback is. So I'm going to show you a video on what one of the parents of one of the patients had to say.
Hi, my name is Marcia, and I just wanted to share my thoughts on the Touchaway app. I absolutely love this app, and I love the fact that I can connect with my respiratory team by just a message, video call, or voice call. I also like the fact that it's easy to use and suitable for parents who have children with respiratory illnesses. One of the perks about the app is that they have a weekly check-in that can determine if my child is at risk for any respiratory illness. One of the bonuses about this app is that you can also view your child's health histories and records by just a touch of a button. I will continue using this app, and I hope any parent out there with any children that has illnesses to use this app as well. And I do hope this app continues. Thank you.
Some other quotes that we heard from families is really around the idea of the ease of use, but also the feeling of being connected. Some of the quotes that were said was, you know, I appreciate the connection to care because of the app. I feel less alone compared to how I felt before. And I feel like potential health concerns can be addressed quicker and much more efficiently. The ease of communication was also mentioned. So a father said, you know, I send a text when I remember a question and they get back to me when they're free. I don't feel like I'm bothering them. And I think there's a lot of means of communication out there, but the fact that you don't feel like you're going out of bounds and you're invited to communicate with your care team is something that has been expressed by many. Also, there was a mention of, you know, having access to things all in one place. So, you know, we always talk about coordinating care as a burden to families. As a parent, I know this is something I spend a lot of time doing. So having access to somewhere I can store all the information, have it easily accessible to me is a great benefit. We have another video now from another family member.
I feel the Touch Away app has made a huge difference taking care of Aaron at home, because I feel much more connected to the kids team. Any concerns that come up, which we've recently had another pneumonia, but we were able to address it quickly and get to sick kids and in a timely manner so that we were able to actually treat him at home. And it's because of this app that I feel that I have that connection. It's a very quick response. It helps alleviate a lot of anxiety and stress taking care of Aaron at home. And I just don't feel like I'm so on my own anymore. Not that I felt maybe on my own before, but I just feel even more supported by this app. And I really hope it continues.
That theme of, you know, not feeling alone and feeling connected is really key, and it's nice to actually hear because we weren't sure in the planning process that would come out, but it's nice to hear from families. We also hear a lot about the usability of it. You know, the fact that things are, you know, you don't have to look up phone numbers, everything's at a click of a button, has been great feedback as well. So that's what the families have to say. We also were interested to hear what the clinicians had to say. There was a real fear at the beginning that this would add increased workload to them, that they wouldn't feel comfortable communicating in this sort of fashion just because it hadn't been done before. But some of the feedback has really been positive. So the messaging feature is amazing. It's so efficient and easy to connect with families. So just not having to search for email addresses or telephone numbers has really been a theme that we've heard from clinicians. And because of COVID, having a three-way calling feature has been beneficial because many people are in different locations. So having everyone jump in on one call and bringing them together has been a bonus as well. And the ventilator downloads really has been a game changer. Having access to that data, without having to pressure patients and caregivers to, you know, bring their machinery in, follow up with them, remind them, is really been a benefit to everyone.
So in summary, in the last 45 minutes or so, we've talked about the LIVE program and also our planned transition to LIVE program, which is the randomized control trial. And I hope that the takeaway point from today is that this program and initiative is so much more than just a video call. It really is a digital provincial initiative. And I hope that it really changes the way that we can continue to provide care to these fragile patients moving forward. And I think some of the early lessons that we've learned and what we've seen is that this initiative has had such a positive influence on relationship building between healthcare providers, between patients and families and their care team. We've seen several benefits already in terms of patient safety. So identifying issues early is a way that we can treat issues early and keep patients out of the emergency room. Also, by having the virtual care plan that has all of the detailed ventilator settings, when machines are being swapped out to the ventilator equipment pool, now that staff team now has access to the up-to-date correct patient settings. We are able to get ventilator downloads, and because of that, because now those ventilator downloads that used to only be updated and put into the EMR and perhaps not even shared with patients are now being put into the app itself. Patients are reviewing these and are asking questions, and we are doing exactly what we hope to do, which is empower our patients and families to take ownership for their care. So I think so far, these are early days, but we've demonstrated feasibility, we've demonstrated benefit, and I think our unique approach really offers the plus for scalability, because we've already got a solution that is provincial, it's pediatric and adult. And we're hopeful that this is also going to be a sustainable solution. Just before this presentation, I got an email from our program coordinator booking clinic visits for September, and she said all 7 of the patients in clinic don't want to come for in-person visits. People want to stay at home. People really want virtual care. And I think we really have developed with patients and families and key stakeholders a solution that is feasible, scalable, sustainable, and also translatable to other clinical programs as well. So thank you very much for your attention, and we would be happy to hear some questions.
Thank you so much, Dr. Amin. Yeah, like you mentioned, we would be happy to hear questions. You can submit your questions in the chat box. And I know we did receive some questions beforehand, so I'll go ahead and share those as well in the meantime as we wait for questions. All right, so even when social distancing rules are lifted, a family asked, can we continue with virtual care for our son on home mechanical ventilation? I heard you just talk about this right now with the experience that you had with your September patients. Dr. Amin?
Yeah, it's a great question, and definitely something that we're hearing about more and more. And I think that COVID-19 really has changed how we're going to practice care changed how we practice clinical medicine during the pandemic, but I also think that it's completely changed how we're going to be practicing clinical medicine post-pandemic as well. And so I think it's important to work with your healthcare team to understand what are essential things that need to be done in hospital and what can be done at home safely. And I think moving forward, it really is going to be a mix of virtual visits and in-person visits.
Excellent, thank you. The next question that we received prior to the webinar is the family mentioned that they haven't had any personal support workers or night nurses in their home since the pandemic, and they have their son on mechanical ventilation. They were looking towards finding any supports or resources for caregivers to learn, troubleshoot, and ask questions. I know you mentioned that the app has resources. Is that a good spot in terms of this virtual care management piece?
Yeah, I think that's an excellent question. I think two things that come to mind. One, you've already heard from Regina that the ventilator equipment pool in Ontario has done a lot of work with developing relevant resources for patients and families related to the technology in particular. So perhaps Homira can distribute the web link for the ventilator equipment pool after. In addition, through About Kids Health through Sick Kids, we've also developed a tracheostomy and ventilator manual that we've developed for patients in particular, and that may be also a helpful resource for you.
Excellent, and I'd be happy to share after the webinar. The next question that we received from a family is that their family is considering home mechanical ventilation for their daughter with SMA. And they were wondering, is there any literature to show the impact of invasive home mechanical ventilation on quality of life for family members, particularly siblings in the home? Are you aware of anything, Dr. Amin?
Yeah, that's an excellent question. I don't know that there's a lot of literature on the impact of the caregiver as a caregiver of a child. There's nothing is coming to mind in terms of the impact in particular on the sibling, but I do think that probably a really good resource would be to reach out to your home ventilator team and see if there can be another family that this family can speak to, and particularly ask that question and choose a family that does have a child who also has a sibling who's ventilated. But I don't know, Francine, Francine probably is the expert in this area, if you have any thoughts or things to add.
I'm not aware as well of any research that says it, but I do agree that understanding how families experience it on a daily basis is best to come from other families. Families really understand the hacks. They understand the intricacies of going to school and getting ready in the morning and things like that, that are really the concerns that other families have. So sharing those experiences and hearing those experiences from another family is really how you'll help make your decision and help be grounded in the reality of what you might experience.
Excellent, thank you. A question that came into the chat box is whether we expect this technology and program to be available across Canada, especially in rural areas.
Mm-hmm. I think that's an excellent question. I think it's a really exciting question, and I think one of the things to say is that because home ventilation, how it's practiced in Ontario, is incredibly similar to how home ventilation is practiced in BC or any of the other provinces. So I think all of us would be willing to collaborate to really be able to extend this and scale this to the whole country and even internationally. So the work has already been done, and we're happy to share that.
Right. Another question that came in is Elizabeth mentioned that her son has a spinal muscular atrophy, SMA, and has been using a night BiPAP for more than 10 years. He's 24 now. He used to go to McMaster Ventilation Clinic. And the question really is, do you need to switch to a different care team to use this app and this technology? He's been stable for several years.
So maybe Regina and I can answer this question together. When we first pivoted from the research trial to offering this clinically in partnership with the ventilator equipment pool, we thought that first we would roll it out to the 7 ventilation programs that were going to be part of the trial, simply because it would help us be agile and fast, because those other programs were already familiar with the technology and already were engaged from that level. This was not ever intended to be exclusive. This is just where the first step was. But our intention is to have this solution offered to all ventilated patients within the province. And so we would be happy to, maybe I'll let Regina talk further, to look at ways that we could help to engage that individual's clinician and clinical team.
Thanks, Reshma. I think you've summarized it very well. I think the intention here is really to make it available equitably to all patients of the ventilator equipment pool. I think that we needed to have a very careful and methodical rollout plan, and it was just I think starting with the 7 participating hospitals just made sense, because those teams were already involved in much of the preparatory work around the RCT. But I think our plan is to see this roll out to as many people, as possible.
Excellent. It looks like there are no other questions, and so I wanted to end today's webinar by thanking our speakers for sharing their insights and an introduction to this amazing technology and program, and for their ongoing work with supporting individuals with neuromuscular disorders. I will post top 5 key learnings from this webinar and also the link to the webinar on our MDC webinars page. And as always, feel free to email research@muscle.ca if you have any questions, and thank you again for participating. Thank you so much, Reshma, Francine. Thank you so much, and have a great day. Thank you, Regina.